Hello and welcome to the final entry in the RSNA 2020 Taxi Line series. My name is Kevin Landwehr, and today I'm joined by President and CEO of TeraRecon, Jeff Sorenson. Jeff, thank you so much for joining me.
Thanks for having me, Kevin.
To begin with, Jeff, I'd like to ask your opinion on how you think the first virtual RSNA went. Do you think that we or the industry at large handled it very well?
Yeah, first of all, yes, I think industry handled the event well, especially in the sense that these are unprecedented times. Just like healthcare workers, are doing things that they wouldn't normally do, trying to put themselves out there because we're all trying to maintain a certain sense of normalcy. I think industry is definitely to be credited for their participation. It was obviously, a different kind of year. This is the right time to be at RSNA, but the wrong place. Everybody enjoys being together. We weren't able to do that. In terms of, our company's experience and what I've heard from industry in general, there were some pros and cons. One thing is we've all learned, the value, the power, the potential of working remotely. It allows our customers to bring themselves together much more easily than they could otherwise. Certainly with vendors being able to bring together global teams, which, even though RSNA is a big event, not everybody's there. So some of the quality of the meetings was better. But there's no reason you have to have a meeting right now either. You can have the same meeting next week. You can could have already had the meeting the week prior. So I think the difference here is that in the new norm, in the sort of new flexible environment that we have, and we're all living digitally, I think trying to constrain people into a sort of a bubble to have an event was only modestly effective. Certainly the traffic was down. I think that can be expected. No one's going to spend as many hours as they would either in scientific sessions or in the exhibit hall when you're doing it virtually. That's just not practical. I think the event was less productive from the standpoint of the quantity. In terms of quality, there was certainly some very high quality meetings that couldn't have happened any other way. And then, the upshot of all of this is that in the new norm, we've learned how to do digital marketing. We've learned how to do digital communication. And I would say that the engagement of the radiology community during this time, right, to have a focused time where everyone is heads down thinking about their clinical needs, their technology needs, their industry relationships, all as a radiology community, created the single best week that we've ever seen in terms of digital engagement. So there is a silver lining that people want to engage with each other. They did engage with each other. We had very high value communications, but they weren't really in the meeting rooms, in the conferencing tools always. But in terms of consuming content, sharing ideas, a vibrant community, it was a very important week for our industry. And I'm just very proud of everybody for stepping up, for contributing, for supporting the RSNA. We all need to be strong next year. And so I think we all made, the very best of a very difficult situation.
As a conclusion to the RSNA 2020 Taxi Line series, where is TeraRecon headed next?
So TeraRecon is headed to the point of care. We want to get closer to the patient. We want to get closer to the patient data. We will always be focused on very high-end, advanced visualization, AI-powered clinical workflows. But what we really believe is that physicians need their workflow to be simplified. They need it to be more informative. There's too much information that is too difficult to evoke into a workflow and inform the clinical interpretation. There's too much friction between the interpretation and the downstream physicians at the point of care. And, as many people know, Just recently, there was actually some news with Medicare being willing to pay for AI that was accelerating care in a way that had a demonstrable benefit to both the patient and to the cost of care. So, I really think that in general, imaging is one of the most exciting areas in healthcare to apply AI. It certainly could also evolve to be one of the most lucrative because we're able to show that there's information and images that can actually drive workflows and make a big difference. The future is about connecting the patient's information and their images and putting those in the actual care, coordinated care path for the patient and do that in a very seamless, natural way. And in the long run, there's a big opportunity to actually create real-world data sets that we can learn from. Many patients, all with the same types of conditions, can help us to learn about what to do with similar patients like that in the future. And since TeraRecon's acquisition by Symphony AI, they're a completely AI-focused investment fund and innovation champion for these types of platforms across many industries. TeraRecon is really their healthcare play. So that's where we're going. We want to create highly informative, interactive, insightful dashboards that are based on real-world evidence to move the dial with clinical care.